How does Ann Arbor staging impact lymphoma prognosis? Imagine trying to understand how a fire has spread in a building. That's similar to what doctors do with lymphoma using the Ann Arbor staging system. This system helps classify how much the disease has advanced based on where the affected lymph nodes are and whether the disease has spread outside the lymphatic system. It divides lymphoma into four main stages, from stage 1, where only a small area is involved, to stage 4, where the disease has spread widely or involved other organs. Sometimes, additional labels like E4 extranodal involvement or B and A4 systemic symptoms or their absence are added to give a clearer picture. This staging system is very useful because it provides important clues about prognosis, which is the likely course of the disease. Generally, early stages like stage 1 or 2 suggest the disease is localized and often respond well to treatment, leading to a better outlook. On the other hand, advanced stages, such as stage 3 or 4, indicate more widespread disease, which can be more challenging to treat and may have a less favorable prognosis. Studies have shown that the stage at diagnosis is an important factor in predicting survival, especially in certain types of non-Hodgkin lymphoma like diffuse large B-cell lymphoma. Staging also guides treatment choices. For early-stage lymphoma, doctors might recommend less aggressive treatments, such as localized radiation or lower doses of chemotherapy. For more advanced stages, systemic treatments like combination chemotherapy are usually necessary because the disease has spread beyond localized lymph nodes. However, in non-Hodgkin lymphoma, stages 3 and 4 are often treated similarly because the disease is systemic by nature, meaning it affects multiple areas or organs. It's important to note that the Ann Arbor system was originally designed for Hodgkin lymphoma, so it doesn't always capture all the nuances of non-Hodgkin lymphoma. It doesn't include factors like tumor biology, genetic markers, or how well a patient is doing overall. Because of this, doctors often use additional tools like the International Prognostic Index, which considers age, blood counts, and other health factors to better predict outcomes. Advances in imaging, especially PET-CT scans, have improved how accurately we can stage lymphoma today. These scans can detect disease sites that might be missed on older imaging methods, sometimes leading to a higher stage classification. This process, called stage migration, can influence treatment decisions and prognosis estimates. PET-CT scans are now standard for many lymphomas because they help ensure patients get the right level of treatment, neither too little nor too much. In recent years, newer staging systems like the Lugano classification have been developed. These build on the Ann Arbor system by including details like extranodal involvement and how deep the disease has invaded tissues. While these newer systems provide more detailed information, the Ann Arbor system remains a fundamental part of initial staging and communication among healthcare providers. In summary, the Ann Arbor staging system plays a key role in understanding how lymphoma has progressed and what that means for the patient's outlook. It helps doctors decide on the best treatment approach and gives an idea of prognosis. However, it works best when combined with other clinical, biological, and imaging data to give a full picture of each individual situation. Always remember that each person's experience with lymphoma is unique, and personalized medical advice from healthcare professionals is essential for the best care.